Are you pregnant and wondering if you're carrying 1, 2, or 3 babies in your womb without doing an ultrasound scan? It is very, very normal to think about that. Now, the Center of Disease Control and Prevention says that out of about 1,000 babies, about 32% of these deliveries are twin pregnancies. To actually detect that you have twins, triplets, or quadruplets is usually done by an ultrasound scan, detected about 7 weeks of pregnancy. But most of the times, women always do the ultrasound scan, mostly around the second trimester. However, there are some signs and symptoms you can have which can tell you you are carrying more than one baby. So here are the signs and symptoms which we're going to be talking about in this episode of Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. Don't forget to subscribe, like, and share the video. Let's dive right in. Talking about 5 signs which you can have that can tell you that you're carrying more than one baby before even doing an ultrasound scan. The first thing is that you're going to have an exaggerated symptoms, pregnancy symptoms. These symptoms are due to hormonal changes. If you're having 2 or 3 babies, therefore these hormonal changes are going to be marked than if it was a singleton pregnancy. So you have things like exaggerated breast tenderness, you have intense morning sickness, you have intense fatigue, you have intense mood swings and all this. So these normal pregnancy symptoms are exaggerated. Once you start having this kind of getting more tired than before, especially with women who have been pregnant before and maybe they didn't have those symptoms, or maybe had mild symptoms, then this time it tends to increase. You might start suspecting that you are carrying more than one baby, but it does not confirm that you are carrying twins. Take note, because even singleton pregnancies, you can still have more of those symptoms. You know, every woman reacts differently. The second one is intense nausea and vomiting. That's you feel nauseous and a lot and more vomiting. That's what we call hyperemesis gravidarum. If you tend to vomit a lot and causing you to get weak, and in that case you're even admitted in the hospital and giving drips, that's intravenous infusions, that's fluid, in order to make you strong. So that's what we call hyperemesis gravidarum. If you tend to vomit a lot, and especially if you had not been doing, if the other pregnancies were normal, you can suspect that you're carrying more than one baby. The third one is you quickly notice that your belly grows more than, maybe you just see that maybe you're 3 months, and by 3 months at least, maybe you might not be expecting to see a belly bump at that time, but you see that your abdomen grows more or quicker than the other times, or than normal. You tend to see here that you might suspect that you're having twins. Most of the times you can see that some women tend to, if they have to measure the fundal height, that's the height of the abdomen, using a tape, most of the times it's usually accurate around 24 weeks of pregnancy. But at that time, many women already know that they are carrying twins or triplets, especially those who usually follow up their pregnancies properly. The fourth one is intuition. Some women just have an intuition, like, I feel like I'm carrying twins. Well, that's just an intuition. And there's some women, there's a study that has actually been done on women who were carrying twins, and some of them actually said they felt like they were having twins even before doing an ultrasound scan. So those are just some probabilities, those are just some symptoms that they can have. Now there's a very, very important, the plasmatic beta HCG, that's the human chorionic gonadotropin hormone. This is a hormone which is produced only during pregnancy, and normally when this hormone is produced, it is produced when implantation has occurred. After implantation has occurred, this human chorionic gonadotropin hormone tends to double every 48 hours. But you see here that if you are carrying more than one baby, it is even about 30 to 50% times higher than the normal value for a normal evolution of a singleton pregnancy. So this beta HCG is done in the hospital using a blood test. These ones can be done, so it can show that it can suspect that you're carrying more than one baby before doing an ultrasound scan. So these ones are just suspicions, but it doesn't confirm. The only test to confirm that you are carrying more than one baby, that's twins, is an ultrasound scan where you actually see the baby in the uterus. So if this was helpful, don't forget to give a thumbs up to our video, and if you want to have a private discussion with me, don't forget to click on the link on the description box and you get to me for further consultation. Thank you very much, and God bless you.